In this video, we will discuss health systems. Specifically, we will focus on understanding health system definitions, frameworks, and debates. How is the health system defined? A system is an arrangement of parts and their interactions that come together for a purpose. Is it a health system or a healthcare system? Is it about activities or people and institutions who carry out these activities? For example, there are individuals and institutions in disease prevention and treatment provision. There are financial intermediaries, input producers, planners, administrators, regulators, and other actors producing system outcomes. The World Health Organization defined in 2000 that a health system consists of all organizations, people, and actions whose primary intent is to promote, restore, or maintain health. Like any other system, it's a set of interconnected parts that must function together to be effective. There are 3 key points here. First, it's about the diverse components in the system. Second, it's about the arrangement of parts and interconnections among the parts. Each component has interacting roles and functions. This is why system thinking is critical. If you look at one component in isolation, you will miss the many ways the component interacts with the other components. Third, all the activities in the system have a primary purpose to maintain health. There are several important characteristics of health systems. First, complexity. There are many actors, many products, and complex connections. Strengthening a health system involves large-scale efforts and takes a long time. And every institution involved must be committed to a long-term goal. Second, conflict. Though the overarching goal is to improve health for the population, different participants in the system have different objectives and interests. Third, politics matter. Current conditions reflect power in society, and a change incurs political process. Fourth, health system is embedded in social context. The culture, history, economy, and social norms are influential on health systems. How would you define health systems? My simple answer is that a health system is a means to an end. Keeping the end in mind is very helpful in evaluating health systems and thinking about health system reforms. Now, let's discuss 2 examples of frameworks for thinking about health systems. One is the Health System Building Blocks Framework, developed by WHO, and another is the Control Knob Framework developed by a team at Harvard University. When you strengthen a health system, you improve the 6 health system building blocks and manage their interactions in ways that achieve more equitable and sustained improvement across health services and health outcomes. Here is a basic checklist of 6 key components for what to think about when we analyze the building blocks and plan to strengthen them in a country. Service delivery. Good service delivery comprises quality, access, safety, and coverage. Health workforce. A well-performing workforce consists of human resources management, skills, and policies. Health information system. A well-performing system ensures the production, analysis, dissemination, and use of timely and reliable information. Medical products, vaccines, and technologies. Procurement and supply programs need to ensure equitable access, assured quality, and cost-effective use. Financing. A good health financing system raises equitable funds for health, protects people from financial catastrophe, allocates resources, purchases goods and services in ways that improve quality, equity, and efficiency. Leadership and governance. Effective leadership and governance ensures the existence of strategic policy frameworks, effective oversight and coalition building, provision of appropriate incentives, and attention to system design and accountability. After introducing the static typology of health systems, I would like to introduce a flowchart for comparison. This is the control knob framework. There are 5 control knobs, or health system reform options, as the means that can be adjusted or changed to strengthen health systems. They include financing reform, payment reform, organizational changes, regulation, and persuasion. For example, Persuasion refers to health education and the changes in knowledge, attitudes, and behaviors among individuals, households, and community as a civic society, consumers, patients, payers, and producers of health. There are 3 dimensions of intermediate outcomes, including access, quality, and efficiency. We measure 3 dimensions in accessibility, including geographic, financial, and timely access. There are 3 final goals, including improving health status, public satisfaction, and risk protection. We attend both to the improvement in the average ones and the worst off in the society in terms of the effectiveness and the equity. Next, I would like to introduce the basic debates in favor of either disease-specific programs or health systems. There are examples of disease-specific programs. The Global Fund focuses on combating HIV/AIDS, tuberculosis, and malaria. The United States President's Emergency Plan for AIDS Relief, PEPFAR, focuses on combating HIV/AIDS. Some of the arguments in favor of investing in disease-specific programs are that health systems has too many problems to be able to achieve objectives in the short term. The burden of disease merits its priority. It's too costly to improve health systems. Therefore, let's have at least one success with our scarce resources. Evidence of success in vertical programs also bring more investments. There are programs investing in health systems. For example, Declarations of Alma-Ata in 1978 and Astana in 2018 called for actions to invest in primary healthcare systems. The Expanded Program on Immunization, or EPI, and its successor Gavi, the Vaccine Alliance, have been investing in immunization systems to prevent a wide range of diseases. Now, let's look at some of the arguments in favor of health systems. One is that we understand the importance of health systems as the increasing important means for health and welfare gains now and in the future. Another is that health system may be the binding constraint for rapid, widespread improvements and for addressing priority public health issues. In summary, a health system consists of all organizations, people, and actions whose primary intent is to promote or restore or maintain health. Important characteristics of health systems include complex connections, conflicting interests among participants, political and social contexts. 2 types of health systems frameworks are the building blocks framework and the control knob framework. The building blocks framework focuses on 6 essential functions of the health system: service delivery, health workforce, information, medical products, vaccines, and technologies, financing, and leadership. The control knob framework assesses health systems performance and guides health systems strengthening efforts by identifying areas of reform, including financing, payment, organizational changes, regulation, and persuasion. Arguments in favor of disease-specific programs include the need to set a priority, more cost-effective, and evidence of success driving future investments. Arguments in favor of health system efforts include that they are a means for health and welfare, and that they are a binding constraint for wider health improvements.